When the ambulance reached the district hospital, the baby was taken to the NICU immediately.
Although the baby was transferred, the delay had worsened the condition of the baby. Repeated episodes of apnea and shallow breathing was observed.
Along with a junior resident, two newly posted interns, Aryan and Sara, were present in the NICU at that time. After being admitted, the baby was constantly being monitored by them. Despite all the efforts, the baby's health kept deteriorating. The interns, under the supervision of the JR, put the baby on a ventilator.
The entire family was in tears and kept praying to God, as this seemed like the only choice left now.
The doctors took all the necessary measures, and yet the baby showed no signs of improvement. It seemed like the damage had already been done. Even with the best support, the baby couldn't survive and lost his battle against death.
The news of the baby's death was no less than a disaster for the family. They couldn't believe how things could change in just a couple of hours. That they were happily celebrating the Goth Barai, unaware of what was going to happen in some time.
The interns, too, were disturbed by this news. Disappointed with themselves, the following day they explained the scenario to the professor and asked why couldn't the baby survive.
The professor, after completely understanding the situation, told them that the baby could have been saved if he was provided a respiratory aid at the PHC itself. This is because the lungs of a premature baby are underdeveloped and fail to function properly, causing hypoxia and cyanosis. The delay in transport from PHC to district hospital increased complication and made the baby's condition even more critical.
To this, Sarah asked, why isn't it possible to make ventilators available in the primary health centers to prevent complications of premature babies?
The professor answered that the ventilators are too expensive to be made available in every PHC. There is critical shortage of specialized healthcare professionals and lack of equipment. Illnesses which can easily be managed in the district hospitals often initiate a crisis in the PHC.
The interns realized that a cost effective respiratory aid is a need of the hour in such remote areas and ambulances that transport babies in critical conditions.
The situation that they face today brought a different perspective in their mind. After all, every breath counts. Will they find a salvator or will babies continue to suffer?
To know this, watch the third episode.